Hello and welcome. Today we're diving deep into a complex group of kidney disorders called paraproteinemic nephropathies. These conditions arise from an overproduction of abnormal proteins known as paraproteins, which then wreak havoc on the kidneys. We'll explore the causes, mechanisms, symptoms, diagnosis, treatment, and more, shedding light on these often underdiagnosed diseases. So, what exactly triggers these paraproteinemic nephropathies? The root cause lies in the excessive production of paraproteins, also known as monoclonal proteins or M proteins. These proteins are typically produced by abnormal plasma cells in the bone marrow. Conditions like multiple myeloma, Waldenstrom macroglobulinemia, and monoclonal gammopathy of undetermined significance, or MGUS, are commonly associated with the development of these nephropathies. In essence, it's a problem stemming from an underlying plasma cell disorder that ultimately impacts kidney function. Now, let's delve into the pathophysiology, how these proteins damage the kidneys. Paraproteins can damage the kidneys in several ways. They can directly deposit in different parts of the kidney, like the glomeruli, tubules, or interstitium, leading to inflammation and scarring. Certain paraproteins can also form organized structures like amyloid fibrils or crystals, which further disrupt the kidney's normal architecture and function. Moreover, some paraproteins can trigger complement activation, an immune response that causes even more inflammation and damage within the kidneys. The specific type of damage depends on the type of protein involved and where it deposits. Unfortunately, precise epidemiological data for paraproteinemic nephropathies are limited. This is due in part to the fact that they're often underdiagnosed and can present with variable symptoms. However, we do know that they are relatively rare compared to other kidney diseases. The incidence increases with age, and they are more common in individuals with pre-existing plasma cell disorders. Understanding the association with conditions like MGUS is important, as many people may have MGUS without knowing it, highlighting the need for increased awareness and screening in certain populations. The signs and symptoms of paraproteinemic nephropathies can be quite diverse, depending on the type and severity of kidney damage. Common symptoms include proteinuria, which is the presence of protein in the urine, hematuria or blood in the urine, and edema or swelling, especially in the legs and ankles. Patients may also experience fatigue, high blood pressure, and a gradual decline in kidney function, potentially leading to kidney failure. It's important to note that some individuals might be asymptomatic in the early stages, making early detection challenging. Diagnosing paraproteinemic nephropathies involves a combination of blood and urine tests, imaging studies, and crucially kidney biopsy. Blood tests are used to detect the presence and type of paraproteins. Urine tests help quantify protein levels. Imaging techniques like ultrasound or CT scans can assess kidney size and structure. However, a kidney biopsy is often essential for definitive diagnosis. The biopsy allows pathologists to examine kidney tissue under a microscope, identifying the specific type of paraprotein deposition and the pattern of kidney damage. This information is critical for guiding treatment decisions. Paraproteinemic nephropathies are classified based on the type of paraprotein involved, the pattern of kidney damage observed on biopsy. Some common types include amyloid light chains at AL amyloidosis, light chain deposition disease as LCDD, cryoglobulinemic glomerulonephritis, monoclonal immunoglobulin deposition disease MIDD, and Fanconi syndrome. Each type has distinct characteristics and requires specific treatment strategies. Treatment for paraproteinemic nephropathies focuses on two main goals. First, reducing the production of paraproteins by targeting the underlying plasma cell disorder, and second, managing the kidney damage and its complications. Treatment of the plasma cell disorder typically involves chemotherapy or stem cell transplantation, depending on the specific diagnosis and the patient's overall health. Supportive care for the kidneys includes medications to control blood pressure, reduce proteinuria, and manage edema. In advanced cases of kidney failure, dialysis or kidney transplantation may be necessary. Currently, there's no known way to completely prevent paraproteinemic nephropathies, as they are often linked to underlying plasma cell disorders that develop spontaneously. However, early detection and management of conditions like MGUS can potentially reduce the risk of progression to more serious disorders. Regular checkups and screenings, especially for individuals at higher risk, are important. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can also support overall kidney health. The prognosis for paraproteinemic nephropathies varies depending on the type of disorder, the severity of kidney damage at diagnosis, and the response to treatment. Early diagnosis and prompt treatment are associated with better outcomes. Recent research is focused on developing more targeted therapies to reduce paraprotein production and prevent kidney damage. Novel drugs and immunotherapies are showing promise in improving kidney function and extending survival in patients with these challenging conditions. The ongoing research offers hope for more effective treatments and improved outcomes in the future.